Now, you're now using brain imaging technologies to study language processing in the brains of unilingual and bilingual individuals.
Well, actually, Denise Klein, I is doing that more than I am now. She came to me from South Africa. She was my postdoc, but we were working on that together for a while, yes.
So what kind of questions can be addressed with imaging?
Well, we were using PET mainly, positron emission tomography. This was before the MR. Now we'd be using MR. Well, here there was well, it's very exciting to be able to look at the normal living brain in action. This is something we never thought we'd be able to do. That's the exciting thing these days about looking at imaging. But we can ask questions about whether, then people have debated this, and Dr. Penfield has done simulation things, and Ogerman on the West Coast, whether if you're bilingual, if you know, and of course we have lots of bilingual people in Montreal, if you are fluent in English and French, let's say, are the same areas in the brain critical for English and for French, or are they different? We've even heard things which are really nonsense, but claims of, well, you know, one's in one hemisphere, one's in the other, that's nonsense. But the just how superimposable are they? How are they? And this in this way we were looking at this. This was with PET, having the subjects either they were native English speakers who had acquired French later, so L1, that was the first language was English and the second language was French, and we would have them doing various basic tasks like repeating words in English, translating words and rhyming and so on. And we definitely were finding the same areas involved. But that, of course, doesn't mean that they're exactly the same. Well, they're probably not. They're not the same groups of nerve cells, but it's certainly the same regions, the same broad regions in the two languages. But then you can use, and Denise has done some of this, you can use sort of adaptation methods, adapt the patient to one language, and you can see if the fact, when you go with PET, when you go on presenting stimuli, the response of the brain diminishes, you get less and less activity. And if you're really, just when you switch languages, you're making no difference, you're using the same population of cells, then if the activity has diminished, it should stay down. But if the brain notices a difference when you shift languages, you should get a recurrence of the activity, and that is in fact what happens. This kind of question. But this work has a strong practical application because we have many patients with brain tumors in the frontal lobes. And here the question for the surgeon is to know, it's the sort of question that Dr. Penfield would have been addressing with stimulation in the operating room, but this is is a better method for the patient and for the surgeon beforehand. It's possible by doing imaging studies with PET and now with FMR, in patients with a brain tumor, to be able to find out which are the regions critical that get excited with our language tasks, and therefore this helps the patient, the surgeon in the operating room. And this technically can be transferred, this information can be transferred actually into the operating room and used as a practical way to protect the patient's language while allowing the surgeon to make as big a removal as possible, is what you would want to do with the brain tumor without too much risk to language.
Right, so you would speak to them in both languages?
Oh, is they bilingual? Yes, but these would be unilingual patients, yeah. That was just a different application of the imaging method to language.
Mm-hmm. Coming back to memory, are tools like Google and smartphones weakening human memory?
I don't know. I really don't know the answer to this.
The constant bombardment and the fact that we can access information without having to retain it.
I don't know what that's doing to our brain. It's not just a question of memory, I suppose. I suppose I have a little bias thinking that it's not very good, but I don't have any scientific answer.
Okay. And How significant are differences in how men and women use the left and right hemispheres?
That's something that one of my first graduate student, Doreen Kimura, has done a lot of work on, and I haven't. I mean, I have not found really, in my work, I have not found gender differences in lateralization of language and things like that, but there have been claims that the bilaterality of language is more common among women than men. I am really much more struck by the similarities than by the differences in any work that I have done on language and the brain, but I'm not an expert. But looking at hundreds of patients going through surgery, and many of them in whom we've done tests before surgery to determine the lateralization of language and left-handers and so on, we haven't found obvious gender differences. But there seems to be a Canadian preoccupation because Sandra Whittleson at McMaster University has done quite a bit of work on this, and she knows more about these hemispheric differences related to gender than I do.
Great. Maybe one last question before I open to maybe a few questions from the audience. You spoke about tumors, and maybe we can talk about stroke and injury. What has your research revealed about how the brain reorganizes itself after stroke or other types of brain injury?
I haven't worked on, you're beginning to see something about me. I am very reluctant to talk about things I don't have experience of. I really am very, very leery of that. And I have not worked with patients with stroke. I have, of course, worked with some patients with brain injury, but only those who have developed epilepsy. I work with patients who have seizures or are having surgical treatments. So I don't have experience of stroke. I think the general principle here is that if you have, I think on the basis of my studies and reading and conversations and so on, my general belief is, and also on the basis of animal work, not on language, obviously, what usually happens is if you have an area of the brain that is really very much dedicated to a particular function, it doesn't have to be language, but where you really know what this area of the cortex is important. We're talking about the cerebral cortex now, and just beneath it if it's a stroke. If you have damage to part of this area, what happens is that the surrounding tissue, which is still part of that area, during the recovery process can recruit neighboring tissue. And so in a sense, this area gets expanded a little, and the part of the recovery, and there's a lot of recovery, is by recruitment from neighboring tissue. But if, in the adult, you're unfortunate enough to have the whole area really that's critical for that function destroyed, then this recruitment doesn't seem to work so well. But I think the recruitment is always with neighboring tissue. It's not, for instance, a magic that if you've got damage in the speech area on the left, suddenly in adult life, suddenly the right hemisphere is doing the job suddenly. It's not that. It's that the neighboring regions in the left hemisphere are being recruited. And the same thing in sensory cortex or sensory areas of the brain, or the sensory motor strip, if there's a recruitment from neighboring tissue.